Vioxx is a terrible tragedy and a profound regulatory failure. I would argue that the FDA as currently configured is incapable of protecting America against another Vioxx. We are virtually defenseless. It is important that this committee and the American people understand that what happened with Vioxx is really a symptom of something far more dangerous to the safety of the American people. Simply put, FDA and the Center for Drug Evaluation and Research are broken.
Since November, when I appeared before the Senate Finance Committee and announced to the world that FDA was incapable of protecting America from unsafe drugs or from another Vioxx, very little has changed on the surface, and substantively nothing has changed.
We are faced with what may be the single greatest drug safety catastrophe in the history of this country. I strongly believe that this should have been, and largely could have been, avoided, but it wasn't. And over 100,000 Americans have paid dearly for this failure. In my opinion, the FDA has let the American people down.
I believe that FDA is unduly influenced by industry, and that undue influence is in part the result of industry money funding FDA operations.
There's an epidemic in the United States, one that has been missed by the mainstream media. In fact, there's no congressional hearings on it. There's no major effort to challenge it or change it. I'm talking about the epidemic of preventable diseases in the United States. Imagine this, 131 million overweight Americans, many of them toddlers and young children. We have an epidemic of diabetes, heart disease, arthritis, fibromyalgia, depression, anxiety disorders, environmental diseases. How did we get so sick? And why, after spending $2 trillion and over 700,000 physicians, over 2 million people in the health field, out of all of our hospitals and medications and medical procedures, why aren't we closer to eliminating these illnesses? I'm Gary Null. In this original, in-depth investigative report on over-medicating Americans, we're going to be asking some hard questions about where's this money going? Who is leading our healthcare crisis campaign? Are we spending any energy and money and resources on preventing these conditions? You turn on television, all you see are ads for either medications if you're sick or products that can make you sick, and especially the children. How did we get here? What can we do to challenge this? That's what we're going to explore. Join me now for this special look at our crisis in healthcare in the United States.
One of the pieces that I wrote for the British Medical Journal recently was about drug company influence at the FDA. And so the front cover of the British Medical Journal had the question, who owns the FDA? The drug industry or the people? To be raising such a question in one of the world's most senior medical journals shows that there is a massive crisis of legitimacy at the FDA.
The major issue Americans confront today is the fact that the FDA acts to protect the financial interests of the pharmaceutical industry as opposed to the health of the American public.
Within the Center for Drug Evaluation and Research, about 80% of the resources are geared towards the approval of new drugs, and 20% is for everything else. Drug safety is about 5%. Congress has created that structure by PDUFA, the Prescription Drug User Fee Act, by which drug companies pay money to FDA so that FDA will review and approve its drugs. For industry, every day that a drug is held up from being marketed, in their minds, that's another $1 to $2 million of profit that they're being denied. And so the incentive is really review the drugs as quickly as possible, approve them as quickly as possible, and don't stand in the way of our making profit. And FDA cooperates with that mandate.
The regulated activities of the Food and Drug Administration are in large measure financed directly by the pharmaceutical companies.
More than 50% of the money that the FDA spends reviewing drugs comes from the pharmaceutical companies. Many people see that as an absurd conflict of interest, and indeed many are calling for an end to such user-pays funding.
That destroys this arm's length relationship. This destroys the distance that ought to prevail between the Food and Drug Administration and the pharmaceutical companies.
And once that funding started coming from the drug companies, they started calling the shots. And basically they said, we're not going to continue to provide this funding unless you help us get these drugs to market. So basically the FDA got marching orders in the mid-90s, started helping bring drugs to market, do it quickly, and they basically have served those masters ever since. We've really been betrayed by the FDA, and that's the only way to put it.
Well, it's kind of weird, but the day before I had my stroke, I couldn't find home plate. You know, I was pitching batting practice to my kids, which I do all the time, and I just could not throw a strike to save my life. Even now I have a little bit more trouble than I used to. Well, I started taking anti-inflammatory drugs in the year 1999. In, I believe it was January of 2002, I switched over to Viox, and I was taking it probably 3 or 4 times a week for about 6 months.
Thanks.
I'll never forget it. It was a Monday. I collapsed at work. I had a stroke right then and there at work. Found myself in the hospital that afternoon. As a result of that, I couldn't walk. I couldn't speak effectively.
We have thousands of people who are being injured by products that the companies know are unsafe. I mean, that FDA knows is unsafe. FDA knew there was a problem with Viox. They knew there was a big problem back in mid-2000. They did nothing about it.
When I testified in front of the FDA Advisory Committee about Viox, the question I posed to them, I said, we will not solve this problem until we answer the following question. Why did American doctors prescribe $7 billion worth of Viox that caused 100,000 heart attacks and deaths after Merck and the FDA understood that Viox is a significantly more dangerous drug than naproxen, provides no better relief for arthritis symptoms, and costs 7 to 20 times more?
The left side of my body is, doesn't work right. And I was working with a piece of woodworking and the blade hit my thumb and scared to death. It's all going up for sale. Every bit of it. And this is all industrial grade stuff. To this day, I have a sleep disorder. I have panic disorder. I have extreme fatigue, which is related due to the sleep disorder.
FDA is responsible for 140,000 heart attacks, 60,000 dead Americans. That's as many people as were killed in the Vietnam War.
I'm a family physician and, had a thriving practice basically at the peak of my professional career, a passionate practice. I did the majority of my work with kids with psychiatric and psychological disorders, and the type of job I could have done for nothing. Unfortunately, since my stroke, we've had to put our house up for sale. As a result of the disability, I've been unable to work, and to tell you the truth, we can't even afford to sell the house with a real estate agent, because of the commission that they obtain from it, so I believe what happened to me is a direct result of Viox. It's the only explanation that has any merit, and the only logical, simplistic explanation that I can arrive at is that Viox caused this situation to occur in my life.
How did this happen? How do we end up having something that can kill 100,000 Americans? And who's responsible?
I think a lot of people think that the approval of drugs by the FDA is tantamount to the FDA guaranteeing that the drug is safe as well as effective. And the truth of the matter is,